respond, you need to check his breathing for at least 5 seconds, but no more than 10 seconds. If she is not breathing or is only gasping, she needs CPR. A person who gasps usually looks like she is drawing air in very quickly. She may open her mouth and move her jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, a snore, or groan. Gasping is not regular or normal breathing. It is a sign of cardiac arrest in someone who doesn't respond. Okay, here's what you've learned so far. You've learned how to give compressions, how to give breaths with and without a mask, how to use an AED, and how to assess the need for CPR and call your emergency response number or 911. So, let's see what it looks like when you put all of these things you've learned together. We're going to show you a demonstration of all of the steps together, from beginning to end, including the use of an AED. Pay close attention because you'll get a chance to practice afterwards. If you find a person who may be ill or injured, first, check to be sure the scene is safe.
The scene is safe.
Make sure the person is lying on his back on a firm, flat surface.
Sir, are you okay?
Tap and shout to see if the person responds. If not, then yell for help.
Help, help, I need help.
If someone comes, send that person to call the emergency response number and get an AED.
You, call 911, get the AED.
Check for breathing for at least 5 seconds, but no more than 10 seconds. If the person isn't breathing or is only gasping, move clothes out of the way and give 5 sets of 30 compressions and 2 breaths. Keep in mind that if no one comes to help you, you'll have to call for help and get the AED yourself. Now, open the airway and give 2 breaths with a mask. Watch for the chest to rise and reposition the mask if necessary. Repeat. Continue until the AED arrives. First, turn the AED on. Push the on button or open the lid.
Attach pads to the victim's bare chest.
After you turn the AED on, it will guide you through the rest of the steps. Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the victim. Shock needed. Charging. Stay clear of victim.
Clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
And that's what CPR looks like, including the use of an AED. Again, the first compressions overall are the most effective, and they become less effective as you go. So remember, if another trained person is present, switch rescuers at least every 2 minutes, even if you're not tired, to make sure you're giving good CPR. While resting, give feedback to the other rescuer to help make sure they push hard and fast. Congratulations. You've just learned CPR and AED use for adults. Here's your chance to practice everything together. The following scenes will show a variety of emergencies. It'll be up to you to take turns showing how you would respond to them. We're going to include using an AED, but only to the point of turning it on, since the AED will tell you what to do in a real emergency. Your instructor will guide you, and after everyone is done practicing, you'll each be tested on your adult CPR AED skills.
You are shopping and find a man lying in a store aisle. There are other people around with cell phones, and there is an AED in the shopping center. As you leave a museum, you find a man lying on the ground. You have a cell phone and you saw an AED in the museum entrance. While at work, you find a coworker lying on the ground. You have a cell phone and there is an AED in the office.
This concludes the adult CPR AED section of the video. Let's take a look at what you've learned. You've learned the most important part of CPR, how to give effective compressions, by pushing down at least 2 inches at a rate of at least 100 per minute, and letting the chest come back up to normal after each compression. You've also learned how to give breaths quickly and effectively, without interrupting CPR for more than 10 seconds. You've learned how to assess the emergency and call for help. And you've learned how to add the use of an AED to give a person in cardiac arrest an even better chance for a good recovery. Just as in adults, when a child's heart stops beating, blood stops flowing through the body. But CPR can help keep a child's blood flowing until other medical care can be given.
Can I help you find anything?
Oh, no thank you. I'm just looking.
Let me know.
Okay. Boys, stop running through the store. Get over here.
You can't catch me. Oh, that's what you think. Mom, come quick.
Boys, what happened?
He fainted again. Found him on the floor. I thought he was just kidding, but he's not waking up, Mom.
Help! Somebody help! What's wrong, ma'am? Are you okay? No, my son! Are you okay? Are you okay? Call 911 right now. Okay.
Welcome to the Child CPR AED module of the American Heart Association's Heart Saver First Aid course. CPR AED is mostly the same for children as for adults, but there are some differences, so we're going to go over those now and then give you a chance to practice a complete sequence of child CPR AED. Before we get started, let's explain what we mean by child. For the purposes of this course, a child is anyone who is older than 1 year and has not yet reached puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. As we mentioned before, compressions are the most important part of CPR. One difference between adult and child CPR is how compressions are done. When giving compressions to a child, you may only need to use one hand. However, you should still be able to push down about 2 inches. If you can't do this with one hand, then use two. As in adult CPR, sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. An injury is better than death. Children often have healthy hearts, but even a child's heart can stop beating if she can't breathe or has trouble breathing. So it's very important to give breaths as well as compressions to a child who needs CPR. Just as in adult CPR, opening the airway correctly will help keep a child's tongue out of the way to make sure your breaths are effective. When giving breaths to children, open the airway and give breaths that make the chest rise, just like for adults. However, for small children, you will not need to blow as much as for larger children or adults. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Masks for children are made the same way as those for adults, only smaller, to fit over the ill or injured child's mouth and nose. Again, you may need to put a mask together before you use it. Remember, there are different sizes for adults, children, and infants, so make sure you're using the right size for the child. AEDs work basically the same way for children as they do for adults. As mentioned earlier, depending on which brand of AED you use, there may be special pads or a key or switch for use on children less than about 8 years of age. If one of these is available, it should be used. However, if you only have an AED with adult pads and it doesn't have a child switch, go ahead and use it. It's better to use adult pads on a child who doesn't respond than to not use an AED at all. Follow the AED prompts and the pictures on the package or pads. If a child doesn't respond and isn't breathing or is only gasping, you need to give CPR. If you're not sure, go ahead and give CPR. It's better to give CPR to someone who doesn't need it than to not give it to someone who does. Since children usually have healthy hearts and breathing trouble is often the cause of a child needing CPR, it's important to get air to a child quickly if he needs CPR. If you're alone when you find a child who needs CPR, you should immediately give 5 sets of 30 compressions and 2 breaths first. Then you can go call your emergency response number and get an AED if it's available. Okay, now let's see what it looks like when you combine everything you've learned together. We're going to show you a demonstration of a complete sequence of child CPR, including the use of an AED. For this demonstration, the rescuer will be alone. Pay close attention because you'll get a chance to practice afterwards. If you find a child who may need CPR, first, check to be sure the scene is safe.
The scene is safe.
Make sure the child is lying on his back on a firm, flat surface. Tap and shout to see if the child responds.
Hey, are you okay? Can you hear me?
If not, then yell for help.
Help! Somebody, I need help!
If no one else arrives to help, then check for breathing. Check for at least 5 seconds, but no more than 10 seconds. If the child isn't breathing or is only gasping, move clothes out of the way and give 5 sets of 30 compressions and 2 breaths. Now, open the airway and give 2 breaths. Watch for the chest to rise and reopen if necessary. Repeat. After the 5th set of compressions and breaths, if no one has come to help, then go call your emergency response number or 911 and get an AED if possible. When you return to the child, turn on the AED and follow the instructions.
Attach pads to the victim's bare chest.
continuing CPR while you wait for someone with advanced training to arrive and take over. If you don't have an AED, continue CPR while you wait. And that's what child CPR looks like, including the use of an AED. Again, the first compressions are the most effective overall, and they become less effective as you go. So remember, if another trained person is present, switch rescuers at least every 2 minutes, even if you're not tired, to make sure you're giving good CPR. And remember to give feedback to the other rescuer while you are resting to help make sure they push hard and fast. Congratulations! You've just learned CPR and AED use for children. Here's your chance to practice everything together. The following scenes will show a variety of emergencies. It will be up to you to take turns showing how you would respond to them. We're going to include using an AED, but only to the point of turning it on, since the AED will tell you what to do in a real emergency. Your instructor will guide you, and after everyone is done practicing, you'll each be tested on your child CPR AED skills.
You are at the local library and find a 5-year-old child lying on the floor. A phone and an AED are at the checkout desk.
A common emergency with children is choking from food or some other object being stuck in the airway. Some choking is mild, and some is severe.
I mean, did you like the movie?
Yeah,
it was pretty good, you know, it was good. And later on, we can go to the park if you want. Son, are you choking? Someone help!
What's wrong?
I'm not sure. I think my son is choking.
Are you choking? Okay, I'm gonna help you, okay?
If a child is experiencing severe choking, you must act quickly to get the object out so the child can breathe. When a child has severe choking, give thrusts slightly above the belly button. If the child is smaller, you may have to kneel to get into correct position. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If a child can make sounds or cough loudly, then the block in her airway is most likely mild. Stand by and let her cough. But if you become worried about her breathing, call your emergency response number or 911. Consider the choking severe if the child cannot breathe, has a cough that has no sound, cannot talk or make a sound, or makes the choking sign. If you think a child might be choking, first ask if the child is choking.
Are you choking?
If the child nods that he is choking, tell the child you're going to help.
I'm going to help you.
Depending on the child's size and your size, kneel or stand firmly behind the child and wrap your arms around the child's waist so your hands are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the child can breathe, cough, or speak, or until he stops responding. If the choking child is very large, put your arms under the child's armpits and your hands on the center of the child's chest. Pull straight back to give thrusts on the chest instead of the abdomen. If you cannot remove the object, the child will stop responding. If this happens, then giving compressions may force the object out. Take the following actions. Lower the child to a firm, flat surface.
Are you okay? Are you okay?
Tap and shout to see if the child responds. If not, then yell for help. Ask someone to call your emergency response number or 911 and get an AED.
Help! Somebody, I need help. Call 911 and get an AED.
Check for breathing. If the child is not breathing, immediately give 30 compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions. After 5 sets of compressions and 2 breaths, if no one has come to help, then call your emergency response number or 911 and get an AED. Give sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions until the child starts to respond or until someone with more advanced training takes over. If someone is with you when you find the child, send that person to go call your emergency response number or 911 and get the AED while you give CPR to the child. After an emergency, any child who has been given thrusts should see a healthcare provider. This concludes the child CPR AED section of the video. Let's take a look at what you've learned. You've learned that CPR for children is mostly the same as that for adults, with a few differences. You've learned that you may only need to use one hand to give compressions to smaller children. You've also learned you should push the chest down about 2 inches during compressions, and that you might not need to blow as much to make a child's chest rise when giving breaths. You've learned that some AEDs have child pads, keys, or switches for use on children. You've learned that you should give 5 sets of 30 compressions and 2 breaths immediately if you are alone and find a child who needs CPR. Then call your emergency response number or 911. And you've learned how to help a child who is choking. Giving CPR to an infant is very similar to that for adults, but there are a few differences.
Hey, how are my little ones doing?
As peaceful as can be. In fact, I was just about to wake little Ava. She's been so quiet. Ava, wake up, little girl. Ava? Ava, come on, you're scaring me.
What's wrong?
Lisa, I don't think she's okay.
Let me have her. You go call 911 and get some help. Ava? Ava?
Welcome to the Infant CPR module of the American Heart Association's Heart Saver First Aid course. Before we start, let's define what we consider to be an infant. For the purposes of this course, an infant is anyone who is younger than 1 year old. Just as in adults and older children, when an infant's heart stops beating, blood stops flowing through the body. CPR can help keep an infant's blood flowing until other medical care can be given. When giving compressions to an infant, you'll need to use just 2 fingers of one hand. You should be able to push down about 1.5 inches at the rate